Hi, I'm Dr. Tony Jabbour. On behalf of the Tulsa Bone and Joint Total Joint Replacement Team, I would like to thank you for allowing us to care for your knee arthritis. If you are watching this video, it means that your doctor most likely had prescribed for you a CPM machine or a cold therapy machine or both. Not all doctors prescribe these, but some believe that they help greatly in regaining range of motion early on after your surgery, and the ice machine will help greatly in decreasing pain after the surgery as well as decreasing risk of blood clots. The CPM machine, or called CPM, is continuous passive motion machine, and this will be set up for you by one of the medical motion reps before the surgery, and basically be able to utilize this at home to work on knee range of motion. We want to make sure, though, that this is only going to be an adjunct for you doing your exercises. You have to do the physical therapy exercises we have instructed you to do after the surgery. We need you to get up, walk, we need you to do the exercises, but whenever you are not walking, then this machine will greatly help with passive range of motion of the knee. In regards to the cold therapy machine, it's also called V-Pulse. Right now it's called V-Pulse, but as technology changes, we may be using something different later on. This machine has the ability to have a compression on the knee, which helps dissipate some of the swelling from the knee, but also coolness on the knee, which helps decrease greatly the pain in your knee. There's also going to be a compression on the calves that's intermittent. That intermittent compression will greatly help decrease risk of blood clots. This will help in conjunction with some of the blood, basically with some of the blood thinner medication that your doctor may have prescribed for you as well after the surgery. A couple of points I'd like to make is that Medical Motion is not a Tulsa Bone and Joint company, but I greatly trust them to provide these machines for you because we believe they will greatly help you in the early period of time after your knee replacement. I will now hand it over to the Medical Motion rep to explain to you how to use these machines.
Hi, I'm Vince with Medical Motion. Today we're going to discuss your passive motion knee machine. If you're watching this video, your doctor most likely has prescribed a passive motion knee machine for you to use after your procedure. Passive motion is meant to prevent scar tissue buildup, get your range of motion back. It does not replace anything else prescribed by your doctor. In most cases, you will be contacted before the procedure and you will already know about this. Even though the machine may look complicated, it is very simple to use. It will be fit to you, and everything you need to know will be shown to you as well. This actually is where the foot straps in. So this is the foot plate. Foot sits flat against here and straps in, just like so. You will be able to both increase or decrease extension and flexion, and there's an arrow on both sides of the controller to be able to do so. There will be a link at the end of the video that will go over specifically what you need to know about this in more detail.
Hi, my name is Jeremy Hall with Medical Motion. You're watching this video because your doctor has prescribed for you a compression and cold therapy device along with DVT prophylaxis. In this video, we'll go over just generally what this means for you. Cold therapy works by restricting the blood vessels in the area, therefore decreasing pain and swelling. When compression is added to that, it also allows the swelling to be dissipated and for the lymphatic system to work properly. The beauty of this machine is that it will allow for 3 different modalities in one machine. This pad will be provided to you and will allow for cold and compression, and this pad will allow for DVT prophylaxis, which just means trying to keep a clot out of your calf.
Hi, it's Vince again with Medical Motion. I'm going to demonstrate how your V-Pulse machine works. So there's 3 options on this machine: cold therapy and 2 options for compression. Wound compression on the joint site that the cold water flows to the same pad, and DVT alternating compression on the calves. To open your machine, it's very simple. Pull back on this white tab, turn it counterclockwise till it stops, and pull up on the lid. On the inside, you'll see this machine actually comes with 2 sets of reservoirs. These can be filled and frozen to replace ice. You'll still need to put water in the machine. On the inside, there's 2 fill lines. First, your water fill line. Secondly, your ice fill line. You'll notice on each reservoir there's a max fill line. Do not fill past this line. Once your reservoirs are frozen, simply drop it in the top of the machine. You'll notice attached to the machine there's a quick reference chart.
If you have any problems with any of these machines, there will be a card most likely on these machines that has a Medical Motion rep number. You'll be able to contact them if there's any mechanical issues with these machines. Again, thank you for choosing Tulsa Bone & Joint for your knee replacement.